Hello and welcome to A Deadly Silence. I'm your host, Larry Curtis, and it's the goal of all of us associated with our program to bring you current and educational information associated with the alcohol and addiction issues, not only here in the city of Brockton, but throughout our South Shore community. Our guest today is Linda Drew. Linda is Director of Operations for the South Shore Wellness and Renewal Center, located in Weymouth, Massachusetts. Linda, welcome to Deadly Silence.
Thank you so much for having me, Larry.
Okay. As Director of Operations for a startup wellness center, I understand.
Yes.
Why don't you tell our audience a little bit about, how you got into the recovery field?
So, like a lot of families here, my family has been directly affected by alcoholism and drug addiction, and the office actually grew out of a need in the community to help service those suffering from addiction, their families, in the surrounding community. So we're trying to build relationships in the community with those in this field.
So having had a family member, a loved one involved in the addiction issue, it's really an opportunity of finding out what's really out there, what help is out there for not only the loved ones of the addict, but even for the community as well.
Absolutely, absolutely. I think, and the key piece is that, to me, there's a lot of hope. I've watched people recover. And that's the exciting news about the people that work in this field.
That is exciting.
We're very excited.
Yeah. So as a new startup, South Shore Wellness and Renewal, tell us a little bit about what type of services would be available to any of your prospective, do you call them clients, patients? What do you?
Clients or patients are fine.
Clients or patients, okay.
Yep. So what we're hoping for is sort of a holistic approach. Right now, we are focusing on offering Vivitrol services, and I can talk more about that, as well as mental health counseling for a wide variety of needs.
Now, when you talk mental health counseling, would this be an inpatient situation,
this
an outpatient?
This is all outpatient.
It's all outpatient?
Although there is a need in the state, and we can touch on that too, for more inpatient treatment. Our office is hoping that we're a viable option for those suffering from addiction on an outpatient basis. A lot of the evidence is showing that, especially for opiate addicts, that the outpatient treatment medication works very well.
Okay. Now, you had mentioned Vivitrol a short while ago.
Yes.
Now, is Vivitrol an additional drug to like the Suboxones or the Methadones, or is it?
So I can explain. I'll explain. So there's really a couple of pharmacological options for people suffering from addiction. The typical ones are buprenorphine, which is Suboxone, right? Methadone, and then naltrexone or Vivitrol. There are the first two, the methadone and the Suboxone, have an opiate in them. So they are great medications.
Some argue that it's a substitute.
Some do argue it's a substitute, but the research does show that these medications help people greatly. Okay. But our protocol does not include methadone or Suboxone.
Okay. We
are hoping to help people using Vivitrol, which is a non-narcotic opiate blocker. It's the injectable form of the pill naltrexone, that medication. So it's injectable form. So there's one of the things we really like about it is that there's no way to abuse or mistreat Vivitrol, as it's injected once a month. So instead of methadone daily, Suboxone treatment daily, this is a once a month injection.
So, and then when you say injection, via needle?
Yep, it's intramuscular. Okay, yep, once a month. Every about 28 days is the recommendation.
Right. And it acts as basically repellent toward any.
It's considered a beta blocker, so it sits on a receptor in your brain that blocks the opiate. So you will not get the desired effect if you use. You'll get no effect. It blocks it.
So that if somebody is being treated with the Vivitrol and they, in essence, relapsed, they'd feel no effect of that relapse, assuming that the Vivitrol had been administered within that 28-day period.
That's correct.
Yeah, from that perspective.
Yeah.
There.
It's a great relapse prevention too.
And so that's pretty exciting news. Now, how long has this been on the market?
So naltrexone's been around a long time.
Yeah.
Vivitrol in the injectable form, which is naltrexone in injectable form, has been used, I think, since about 2006 for alcohol dependence. And I think it was approved in 2009 or 10 for opiate dependence. I think it was used off-label for a brief time prior to that, but it has great potential in this community.
In assisting the addict in
recovery.
In recovery.
Now, there's no, and if you think about what best practices are for helping those affected by this disease directly, it needs to be more than just that. Methadone alone, Suboxone alone, and Vivitrol alone will not, determine success for a patient. There's a lot of other resources that we encourage people to
you had mentioned
participate
them
in.
kind of as the mental health aspect of
Absolutely.
of the recovering aspect out there. So what, you have a client or a patient who's, using the Vivitrol. What type of additional support bases when we talk about the mental health aspects of, counseling, whether it's individual, whether it's family, what other aspects does the program offer, or will it offer it?
Yes.
And what is actually out there today for the addict above and beyond that, not just out of your organization?
Right. So there is a lot out there right now. I think sometimes there feels like a disconnect between different various places and organizations and facilities and how best to treat. There's a lot of opinions. I think that when you really look at this as a chronic disease and think about, the biopsychosocial components of this disease, it's really complex. So the support for any individual who's suffering from this disease really does need to incorporate all three of those things. Especially the psychological and the social, meaning socioeconomic things. A lot of, depending on where you are in the spectrum, when you started, how much damage has been done. A lot of times folks have so many concurring issues going on. They're jobless or homeless or, physically and mentally dependent. And so how do we meet people where they are? And I think that it's so important for the right support services. Like, I know our office is going to try to help everyone that calls our office and everyone that reaches out to our office. And there'll be instances where maybe we'll recommend they need inpatient treatment prior to coming in. One of the things about Vivitrol, if that's what they're calling the office for specifically, is that you need to be opiate-free for 7 to 10 days. Okay. So a lot of times it's just a great way to sort of reach us would be, head into a treatment facility, and inpatient.
When we talk treatment facilities on that scale level, are we talking about detoxing, basically speaking?
Yes.
So basically the individual who may want to try the Vivitrol program basically really needs to go through the detox program, and I think you mentioned 7 to 10 days.
7
free.
to 10 days without the opiate. We can help patients with that in the future with an outpatient detox. But oftentimes, depending on the circumstances, it may be beneficial for the patient to have an inpatient detox. But the thing with the inpatient detox is they aren't necessarily 7 to 10 days away from an opiate. That's where there's a disconnect. So certain programs that are trying to get folks on the oral naltrexone before they are discharged from the facility. So if they can do that, and their case manager can follow up with a phone call to us, it's a great transition, great opportunity to not have a gap in treatment, right?
Because you could have a 3 or 4 day gap in the treatment from the time you detox to the...
You could have the gap in treatment. So the best is sort of communication among providers, really. So that we can sort of, there's no safety net really in place.
Well, let's talk about the provider issues out there. I mean, here you've got a program, that you're setting up there out in Weymouth, and it sounds very, very exciting for the, recovery, the individual who's in a recovery mode. What other agencies how do you get your clients ultimately, or how are they referred to your specific clinic?
Sure.
And what agencies are you working with out there in the South Shore?
Great.
Yeah.
So let's see, we've done a lot of outreach. As I mentioned to you prior to the program, this has been in the works since August. We opened on March 3rd. It's a process. So what we did in early February is sort of reached out to everyone in the community that we could, either sending them a brochure, some information about us, or we've attended a lot of meetings, especially in Weymouth. There's a substance abuse prevention coalition in the town of Weymouth that we've attended. We've been to the mayor's office for her opiate task force coalition that meets. Learn to Cope, which I know you're familiar with
Learn to Cope.
Joanne Peterson, and we do a lot of outreach. Manat Community Health Center in Quincy. They do a lot of work on the South Shore, a lot of great things.
There are like 5 or 6 Manat facilities on the South Shore.
There are, and they're very active in the community and a lot of outreach.
Yep.
And they're involved in the training for Narcan.
What about South Shore Hospital? You're right there in Weymouth.
We're right across the street. We've reached out to, one of the things that sometimes is of concern to me is, the first responders, folks that show up at an emergency room with an alcohol or drug problem, and also, law enforcement and things like that. I'd love to see the Narcan training going on with law enforcement. But I will say it's a challenge over at the emergency rooms at the hospitals.
Yeah.
Just to let you know, we've reached out to South Shore Hospitals,
Yep. Good.
Their social work department on several occasions. And we've also dropped off information about our office. So they are aware that we are across the street from them. And I'm hoping to build a relationship with them at the hospital to know that we're here. And it's at whatever capacity they might need, referring patients over.
You had mentioned expanding the Narcan training within, our public safety issue, both the fire, rescue, and EMT ambulance thing, and here in the city of Brockton, under Mayor Bill Carpenter, we've just in the past month have actually implemented the Narcan for all fire and rescue apparatus, and I believe our police are currently going through the training of that right now so that they'll have access to that as well as first responders, and be able to assist. And there have been, I think, in the first 10 days, about 8 saves.
Isn't that amazing?
Recorded,
that's something that the city can be proud of, to take those steps, because there's no hope for recovery for people that don't make it.
That's right.
So I think that's fabulous. I think it's needed, and I'd like to see it in all of the South Shore communities.
Now, one of the perplexing issues of recovery really centers around the cost. How is the cost of your client, your patient, handled in relationship to, is it insurance reimbursement? Is it, private pay? Is it, funded through grants that, might exist out there? How does that work?
Right. So what we hope is that everyone's insured, right? And that
well, if you listen to Obama, we allegedly are, yes.
Well, Massachusetts was a leader in that, so
Absolutely.
We're supposed to be insured
yes.
here in Massachusetts. And it's funny because, well, not funny, but there are places you can go to that will help guide you with your insurance. I mean, they have a navigator over at, they call it an insurance navigator over at Manat Community Health Centers. I actually referred somebody over there for that reason, to help get your insurance up and running, because we get calls from a variety of different places, other facilities, Gosnold and High Point, and Bay State, and AdCare, but we also get people who see our website, or if you go to the Vivitrol website, because some folks do know about Vivitrol. You know, we're listed there as a
What
provider.
is that website? Can you give us that website name right now?
Vivitrol?
No, the website you're referring to right now.
Oh, yes. Our website is, you can go to www.ssrenewal.com.
Okay.
Or you can Google South Shore Wellness and Renewal, and you'll get there.
Beautiful.
And it's a work in progress. But we have a Facebook page, too.
Okay.
So anyway, insurances, we take, we're working on being fully credentialed with all of the insurance carriers. That the list goes on. And so, you know, we accept a lot of insurances.
Okay. What efforts are available for the prevention and in identifying the youth that are at risk out there? What happens?
This is where I think that I'm happy to do any kind of outreach and you know, anywhere on the South Shore. If I can drive there, you're in my community. That's how I feel. Okay. So I think that you know, that whole phrase, it's, you know, a little cliche, but it takes a village. You know, some people look at this as a law enforcement problem. Let's catch all the drug dealers. Let's, you know, throw them in jail, lock them up. You know, or you know, they don't. You know, there's a lot of guilt and shame that, you know, surrounds the addiction community and people affected by it, families and mothers and the addicts themselves. And I think that, you know, if we can reach out to the broader community, you know, the adjustment counselors at the high schools, the law enforcement.
I mean, the education of the community out there. I mean, if you're a parent or you have a loved one that's involved in addiction, you understand the elements you were just talking about, the shame, the guilt, you know, the embarrassment and so forth. And we've got to find a way to educate the other members of the community that really this is a disease. You know,
absolutely.
You know, this isn't an embarrassment, you know, or a guilt trip, you know,
No.
on the part of the parents or loved ones.
Right.
You know, this is a disease, no different from cancer or anything else that, you know,
Right.
might affect the body.
It's a chronic disease. It's a chronic disease. You know, and that means that it continues for a long time, and that it's incurable, but it's manageable. You know, it's manageable with treatment. So what does that treatment look like? And it looks different for different people. And that's the truth of it. And with all of those elements that we've discussed that go into this.
Do you see stages of recovery that take place?
I do.
In the course of a recovering addict?
I have seen that. And I think that, you know, it's a baffling disease for a lot of people. And I know it can anger people at times. You know, these aren't bad people getting good in the course of recovery. These are sick people getting well. And, you know, I think...
That's an interesting... I like what you just said. These are sick people getting well.
That's right.
That's a tremendous statement.
Yeah,
we gotta remember
I
to
didn't
use
invent
that.
it,
I like
but
that.
but I like it too because it's true. It
Mm-hmm.
rings true to me.
Yep.
And the things that ring true, you know, I think I find helpful. And it's sort of, what can we learn about the people who are in recovery, who have embraced recovery, who, you know, so there's this sort of, you know, the physical dependence, the mental obsession, you know they need to seek treatment. So then, you know, the next step is seeking treatment. And what does that treatment look like for that patient? You know, not what it is. I think one of the barriers to success is people's preconceived notions about what that looks like, even the addict themselves. How willing is the addict to participate in their recovery? That takes a lot of work, but that's probably one of the more determining factors of success. If you can encourage them to continue with the treatment protocol, a treatment program, you know, including a 12-step program outside of, you know, meeting with their clinician, meeting with their doctor, you know, meeting with groups. 12-step work has been probably the best thing that happened to any addict, if they can embrace that.
I mean, you know, you've got the Alcohol Anonymous 12-step program, you know, and you got the Narcotics Anonymous out there. But I mean, I actually have a son who is part of the AA, you know, recovery programs out there in the 12 steps, and he's done tremendous success, you know, following those steps, and even to the point of, you know, working with a lot of younger adults, because when you think of Alcohol Anonymous, you think of older drunks. I'm sorry to characterize
no,
it,
that's fine. Fair enough.
But the addiction issue out there, we really got a young audience out there of addicts.
Absolutely.
And I'm proud of what my son has done in relationship to kind of working with the 12-step program at AA, and yet branching off programs that are, drug and alcohol free for younger adults.
Absolutely.
That are in the program.
And you should be proud. It's fabulous. And I think one of the things that AA has captured, or one of the many things, is the idea of sponsorship. The fact that your son is willing to go out and then help another. Okay?
Mm-hmm.
So, and why is he qualified to do that? Because he's successful in the program.
Mm-hmm.
He's in recovery, and when you think about what recovery is, it's not just abstinence from, it's slightly more than that. You've joined the community, you've rejoined the community, you're a productive citizen. You feel a sense of pride and obligation towards those around you.
Right.
And I think that's what everyone should hope for themselves.
What do you see in relationship to the relapse? I mean, it's kind of said in the general aspects that relapse is part of recovery.
Right, and that boy, does that make some people upset, right?
Well, exactly.
Right.
Mm-hmm.
But if you think back to that chronic disease model, right? And so we just attended the Harvard did a conference at the Park Plaza for a Friday and Saturday, and it's their substance abuse conference, and it was interesting. It wasn't all that new news, but one of the things that you see over and over again is that they compare the chronic illnesses of diabetes, hypertension, and addiction, and the rates for relapse on all three of those, meaning I'm not compliant with my protocol, is about 50%.
Wow.
Right? So if we want to look at it from a medical perspective, that's sort of where we're at. Is it good enough? No. No, 50% isn't good enough. So what can we learn from the folks who are succeeding? The people who are using the best practices in the
As part of that whole recovery aspect, when your patients, utilize the Vivitrols and the mental health services that you have available, is there any support or guidance for the family member or the loved one?
Well, we have counselors that are absolutely, do family counseling, family therapy, and we can always direct them to other groups. Al-Anon, Learn to Cope. There are resources out there. AdCare is actually hosting an event in March on a Monday night. It's free for all families. I'm sure you can find it on their website. I wish I wrote down the date, but it's right in Quincy, and it's an informational evening, and they're going to host it, I think, once a month.
Okay.
Yeah. So there are resources out there.
Yeah. One of the changes that I hear out there in the industry in maybe the last 2 or 3 months is that we're trying to change, almost from a marketing perspective, if you would, the fact of the individual being an addict to being a person in recovery. Have you heard that?
Well,
an addict denotes a negative to some extent.
But there is a big difference between an active addict and a person in recovery. The active addict is suffering. They're ill.
Right.
Okay, and the person in recovery, is not.
The person in recovery doesn't want to be classified as an addict, though, going kind of forward.
Well, it really depends. I think it depends on the individual. This is a very stigmatized disorder.
It absolutely has.
It's just so I think it's a personal journey for everybody, and everybody that goes through it, and how they see themselves, and whether they see themselves as part of a group of people that suffer from the same illness, or someone unique that this is just a piece of my life, and now I can move on.
With the explosion of the heroin epidemic here in the South Shore community of Massachusetts in particular, what has caused that to happen from anything that you've seen out there in the recovery field?
I wish I could. I wish I could answer that question. I'll give you my theory.
Absolutely.
So I think that we sort of had this explosion of OxyContin, in the late '90s and early 2000s. I think that there was a lot of overprescribing, and it's a proven fact.
That continues today.
It does continue today, and with more to come. There's some new drugs coming out that are after everything we know about OxyContin. It shocks me, but
correct.
That's not my battle, I guess. But so how do you unring that bell when you have all of this medication floating out in the community, in the medicine cabinets? People are unaware of what it's going to do to them, what potential for addiction there is. And then you have kids trying things, taking a pill out of the medicine cabinet. And, one of the determining factors for future substance use disorders, as they're classified, is when you started. It's tragic, so that
we're seeing the need to educate at the middle school level today.
We really are.
It is a tragedy.
One of the fascinating talks at that conference that I just went to was one about the brain and what happens and what's the determining factor for ongoing substance problems. And it's it's that frontal lobe so severely affected by early use. Early use of, it doesn't matter what it is, alcohol, marijuana, opiates, certainly.
Smoking.
So it's affecting, the chemistry in your brain, and it's
says
ongoing.
That the adolescent brain really doesn't develop until they're in their 20s. To its
and there's
full
evidence
potential.
saying 20s and 30s now.
Wow.
They're doing a lot of research on the brain. It's fascinating.
Tell us how somebody can get in touch with your organization. Phone number, website. You mentioned Facebook. How would somebody contact your organization?
So you could. You can look us up on the web, and the phone number and fax number are there. It's 781-812-2701 is the main line, and we have the office staffed Monday through Friday. Business hours 9 to 5. We are open in the evenings, so there's clinicians seeing folks, but we don't necessarily answer the phone at those hours. But if you need an evening appointment, we are taking new patients, and we'd love to hear from anybody that needs help.
Well, Linda, believe it or not, we're done. The time is flown
by.
I told you it would happen.
I've only just started.
Linda, thank you for coming and sharing with us, the opportunities that South Shore Wellness and Renewal will offer out there. The Vivitrol subject sounds very, very exciting, and I'm sure there's going to be a lot of people wanting to look into that a little bit further versus the methadone and the Suboxone type issue. On behalf of Deadly Silence, we want to thank you for being here. And
thank you, Larry, so much.
Thank you. Everybody have a good day.